Good morning, and thank you for reaching out to your community health nursing students on education about Juan's recent diagnosis of fibromyalgia. Today, Amanda, Lauren, Lady, and Miriam will be providing education to you and your family about this condition and different ways to manage it effectively. Let us know if you have any questions throughout the presentation, and we hope that you are able to learn some important information about your new diagnosis of fibromyalgia. After your recent diagnosis of fibromyalgia, I am sure that you have many questions about this condition. The biggest question being, what is fibromyalgia? Well, fibromyalgia is a chronic, meaning long-lasting pain syndrome that involves chronic fatigue, generalized muscle aching, stiffness, sleep disturbances, and functional impairment. Now, you might be wondering, how is fibromyalgia managed? Well, fibromyalgia is treated based on the specific symptoms reported by the patient. It is important for you to know when you have fibromyalgia, you have to manage the disorder to reduce the pain and symptoms that you are going to be experiencing. In many cases, fibromyalgia symptoms go through flares, where symptoms are severe, and then there are remissions where the symptoms are minimal or even absent. Patient support is essential to provide patients with encouragement and listen to their concerns to help them make changes that are necessary to improve their quality of life. So please make sure that you communicate effectively with your healthcare provider and your nurses so we can figure out a pain management system that is most effective to help you. On this slide, I'm going to talk about the causes and modifiable risk factors of fibromyalgia. Despite ongoing research, the specific cause of fibromyalgia remains unknown. However, various factors, including chronic pain, anxiety, depression, physical trauma, stress, sleep disturbances, and viral infections have all been identified as contributing factors. Identifying these risk factors is crucial for early intervention and management. Additionally, fibromyalgia frequently coexists with other conditions like osteoarthritis, rheumatoid arthritis, lupus, and chronic fatigue syndromes, posing additional challenges in patient care. Nonetheless, individuals can take proactive measures to reduce their risk, such as prioritizing adequate rest, addressing mental health concerns, and maintaining overall wellness practices. By understanding and addressing these factors, the objective is to minimize the negative impacts of fibromyalgia on an individual's life and boost their overall quality of life.
According to the CDC, some signs and symptoms we should be aware of include pain and stiffness all over the body, otherwise known as widespread pain, tiredness, depression with emotional distress as well, sleeping problems, GI issues such as bloating, abdominal pain, and irritable bowel syndrome. Overall, self-management is aimed at improving symptoms and the quality of life. We have things like aerobic and muscle strengthening exercises, stress management techniques such as meditation, music therapy, art, praying. We have to attain adequate sleep habits, maybe 7, 8, or 9 hours of sleep depending on the person. We can also do cognitive behavioral therapy for patients with depression. This would change their negative thoughts with positive ones. We can try medications for pain relief such as NSAIDs, SSRIs and SNRIs, tricyclic antidepressants for better sleep, and anticonvulsants such as pregabalin and gabapentin for nerve pain.
Now I will discuss the creation life principles for managing fibromyalgia, starting with the principle of choice. One of the most crucial steps in managing fibromyalgia is to educate yourself about the available treatment options. This empowers you to make informed choices regarding your healthcare. Moving on to the next principle, rest. Establishing a calming bedtime routine is vital in promoting relaxation and improving sleep quality, both of which are essential for managing fibromyalgia symptoms. Simple practices such as dimming the lights, avoiding screens before bed, and engaging in relaxation techniques like meditation or deep breathing can help signal to your body that it's time to unwind and prepare for restorative sleep. Creating a soothing environment at home is another crucial aspect of managing fibromyalgia. Soft lighting, comfortable surroundings, and minimizing noise can help reduce stress and promote relaxation. Consider making adjustments to your living space, such as investing in ergonomic furniture, using aromatherapy, or incorporating calming colors and textures to create a sanctuary that supports your well-being. Next up is activity. While exercise may seem uncomfortable when dealing with fibromyalgia, engaging in low-impact aerobic exercises such as walking, swimming, or yoga can help improve overall fitness and reduce pain and stiffness. It's essential to start slowly and gradually increase the intensity and duration of your workouts as tolerated. Trusting yourself and your body is crucial in managing fibromyalgia. Keeping a journal to track your symptoms, treatments, and progress can help you identify patterns and make informed decisions about your healthcare. Moving on to interpersonal relationships. Living with fibromyalgia can feel isolating at times, but joining a fibromyalgia support group can provide invaluable emotional support, practical advice, and a sense of community. Setting realistic goals and celebrating achievements is essential for maintaining a positive outlook when managing fibromyalgia. Lastly, nutrition plays a significant role in managing fibromyalgia symptoms. Eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can provide essential nutrients to support your overall health and well-being.
Based on the Newman System model, the physiological effects of fibromyalgia include fatigue, insomnia, morning stiffness, cognitive impairment, irritable bowel syndrome, and obesity. Psychological issues like depression, anxiety, borderline personality, obsessive-compulsive personality, and post-traumatic stress can arise from fibromyalgia, and in some extreme cases, suicidal ideation. The social cultural aspect is affected because the individual's capacity to face and cope successfully with environmental and daily life demands is reduced. They usually display negative body image and low self-esteem, which affects their quality of life. Regarding a spiritual connection, they seek help from the higher power, God, to regain inner peace and acceptance of their health condition, and in some cases, they search for forgiveness. The developmental aspect is affected early on in life if the individual is not able to learn mechanisms to deal with stress. It can affect their physical health by emotional distress. Additionally, the individual can have cognitive deficits, which can cause issues with work performance and daily activities. For preventative measures, we want to educate the community on the importance of primary prevention. Identifying factors predisposing individuals to fibromyalgia, such as car accidents, work injuries, fractures, medical interventions, complications from surgeries, infections, and emotional traumas from sexual and physical abuse. For secondary prevention, seek immediate medical evaluation for acute pain and develop strategies to live a healthier life, including stress management, sleep hygiene, exercise regularly, pacing yourself, maintaining a healthier nutritional lifestyle, and using cognitive behavioral therapy. For tertiary prevention, we want to ensure the individual adheres to pharmaceutical treatment and non-pharmacological alternative therapies. Other preventative measures include massage, myofascial release, acupuncture, chiropractic, yoga, and herbal supplements. Adhering to a healthy lifestyle is crucial. Weight management, mental health, vaccinations, health screenings, and annual checkups are of the utmost importance in decreasing the prevalence of other health issues.
One resource available for those living with fibromyalgia is the Fibromyalgia Care Society of America. This organization takes a comprehensive approach to care, understanding that support from family and peers is crucial for patients' well-being. Their focus is not just on managing symptoms, but also on empowering individuals to live fulfilling lives despite the challenges of fibromyalgia. One of the services offered by this organization is empowerment groups, which create a secure space for patients to openly share their experiences, learn from others, and develop effective coping strategies. Additionally, this organization offers an employment assistance program which assists patients in navigating workplace challenges and finding suitable employment options, ensuring they can maintain their independence and livelihood. SupportFibromyalgia.org is another valuable resource for the fibromyalgia community. As a nonprofit organization, their mission is to educate and uplift individuals affected by fibromyalgia. They acknowledge the significance of personalized assistance, in which they provide specialized services designed to meet the diverse needs of various demographics. Additionally, they provide group health coaching sessions that offer practical guidance and support in managing symptoms effectively, promoting a sense of community and empowerment among participants.